I would now like to invite Hakim M Salim Khan for his presentation titled Unani Tibb in UK and its future. Hakim Salim is the director of MohsinHealth Clinic and Products UK. He's also the principal of College of Medicine and Healing Arts UK. He has been helping patients and training students in Tibb, USA. He is also the founder trustee of World Unani Foundation. Hakim Salim Khan.
Bismillah ar-Rahman ar-Rahim. Assalamu alaikum, everyone.
Salam.
Good morning, good day, and good evening to all the participants and viewers. First of all, I am very grateful for Mohsin Saab and his colleagues and his team for organizing this webinar, and in particular giving me an opportunity to share some thoughts and ideas, and in particular some of the work we're trying to do here in UK towards the globalization of this very earlier and noble tradition. What I want to do really is to seek permission and share some information for our listeners and viewers on the screen.
Yes, sir. Please go ahead.
Sorry, it's what?
No, nothing. That's it.
Okay. So I have this presentation in a couple of sections. So let's start with contextualization of.
Sorry to interrupt, sir. Looks like we are just seeing a blank screen, blank white screen.
Okay. Fortunately, we have a very able technician here, so let's see what we can do. Can you see anything now?
No, just a blank screen with your mouse pointer moving around.
Share the screen.
Yep.
Is that okay now?
Thanks.
Yeah? Okay. Right. Sorry about that. So I thought we set the context. I'm sure many of our listeners and viewers are familiar with United Kingdom, but here is a little bit of history. You can see some good images here, I hope. Now, obviously, United Kingdom is the home of democracy, so our parliament. You might also be familiar that really UK, and particularly England, was also the home of what is called Industrial Revolution. Now, what's really fascinating is that Britain was the first country in the world which made in 1948 universal health care free at the point of delivery for every person in this country. And this is the first picture which was taken of the first patient that was served under the NHS in July 1948. This was our Minister of Health. Now many things developed. I'm jumping quickly because of the time need. In 1968, there was an incident worldwide called thalidomide drugs, for those of you who are familiar with that. And UK government then, like many other governments, looked at the whole area of practice of medicine, including herbal medicine. And they came up, interestingly, through the public demand to make special provisions for the practice of herbal medicine in UK. And this continues to be. So our practices are actually under the part of this act. You'll see these two sections. One is where herbalists are exempt from many rules and regulations which are affecting other disciplines. And then there's also provision for what is called OTC products of herbal nature. Fascinating that in 1544, there was a herbalist charter which allowed the practice of herbal medicine formally. And this continues to be the case even now. And this was the Mary King of England who gave that charter to the public. Then in 2004, there was part of the European kind of EU, when Britain joined EU, there was a European directive on traditional herbal medicine. So we were affected by that as well. There is a little more detail of that. Now, the current situation of NHS, which was founded in 1948, is not very healthy. Here are some facts and figures that I'd like to share with you. Before this pandemic, we used to have a crisis each winter. Now we have a continuous pandemic crisis globally and here as well, but winter especially is a hard time. Here is the situation that the targets set by the various governments are actually not achieved by the NHS, such as accident and emergency targets, and so on and so forth. Let me move forward to some other matters. As Dr. Khalid mentioned, that one of the problems today is that 80% of the contemporary non-communicable diseases are actually lifestyle diseases. And I just showed this because the world aspires toward this lifestyle generally. Yeah, here's some reflections of contemporary lifestyle. So non-communicable diseases are now the largest burden on NHS. In particular, cardiovascular diseases, chronic respiratory diseases, cancer and diabetes. These account for between various estimates between 70 to 80% of the population. Again, chronic lifestyle diseases, more and more people are living with these by the age 65. Most people will have one or more of these. Here is just a reminder that top 10 causes of the death globally is again chronic lifestyle diseases. Here is a situation which is fascinating and interesting, especially for those people who are in the so-called developing world, to see that Britain, with all its resources and all the funding that goes into NHS, is unable to meet the population needs. So we're now spending 10 times more on our healthcare than we were in 1948. This is taking into account the growth in population and the aging population. When we consider that, still it is 10 times more. Here is a picture of some of the healthcare professionals in the NHS. So here, it is in this context of NHS and its kind of inability to solve chronic diseases, where the complementary and alternative medicine comes in. Again, in 2000, there was a House of Lords major investigation or look into the various diversity of complementary and alternative medicine, including Unani medicine. These are some facts and figures, how popular complementary and alternative medicine actually is in UK. These are old figures, so now things have improved in that respect. These are some of the reasons why, or what type of complementary therapies are used by the population in UK. As you'll see, herbal medicine is very much at the top. These are some of the reasons why people come to complementary and alternative medicine, including practitioners of Unani medicine, various range of reasons. Again, some recent report saying that the NHS will actually benefit from introduction of complementary and alternative medicine into the NHS itself. So what is the future of Unani medicine in UK in particular? We have at the moment from the college trained graduates practicing in UK, number of them, but also through the college in the States, United States of America, in France, and in Turkey. Again, I think these are some of the reasons for patients seeking help. You can see that there is more than just wanting to get better. These are some of the ideas that we offer. So one need, people come to us, they want to be reconnected with nature. Here is one of our volunteers working with a group of students and public to take them to medicinal herbal places and nature. Again, people want an individualized approach to their health. Here is one of those. For us to really move with Unani medicine, we have to integrate other beneficial therapies into Unani. So iridology is one area where the college actually introduces this into Unani teaching and practice. Again, personal prescription. Fortunately, in England, we can make an individualized prescription for our clients and patients. What's interesting that for us to move Unani medicine into the culture, we actually had to adopt some of the formulations. Those of you who are familiar with this, Jadid Sharifi prescription, we've adjusted it to the British and the American herbal situation. Again, we have to rebrand the products. If we say Ayush, nobody understands, with all due respect, Ayush, so we have to give it new presentation, new meaning, and alter the formulations in the legal and contemporary availabilities. So future of Unani medicine, again, the college is a not-for-profit organization. We have various locations where we go and train people. Currently, we have many hundreds of students from more than 19 countries. We use what we call a return to nature retreat format, which helps people to live the experience. Again, we have a beginning of some free courses for the public. We have some online courses which people can take. Yeah, and we recently combined for first time Unani Tibb and its lifestyle with coaching, which provides group and one-to-one coaching facilities for anyone at any location as long as they have access to the internet. This is called the Tibb transformation. We actually launched it only a couple of months ago. Again, one of the challenge we have is that how do we translate and convert Unani knowledge and skills into appropriate cultural and contemporary languages. So we've tried to summarize things into mostly 4 areas and give it some contemporary approach to it. Again, the Tibb transformation is the latest development, and we feel this will take Unani with a lifestyle trained coach into people's homes. It's first time that we're aware that really Unani has been made available by a guided process through this. We have also a professional diploma course. We've actually put together, the college has specific manuals to teach the graduates, because as many of you are aware, literature from South Asian context really doesn't work, never mind the issues of language and the presentation. Fortunately, we have developed a guild of Unani Tibb, which takes the graduate of the college from America and from England, and recently we opened a chapter in the United States. And we use the word guild particularly because it's fascinating that Unani medicine actually has been here in UK for more than 2,000 years. It came with the Romans. Again, in future, we've already been working for about 6 months hopefully with various universities, and we have an intention, and we've made some arrangements to hold the first conference, international conference of, role of Unani medicine in the 21st century, located in Cambridge, and we're looking forward to some of our eminent speakers, but also other people. So again, I just want to share that there are many opportunities, as people can see here. This summarizes the Unani's holistic and individualized approach. It has a great interest in the public health, maintenance of it, and it can solve most of the chronic lifestyle diseases. It is preventative tradition, and there is a harmony between the individual, the environment, and also finally it is very cost effective. Now, again, 2 years ago, for first time, the college and its associated organizations were invited to do the first ever Unani Day presentation on the work of Unani medicine in UK to bring it into the mainstream healthcare. These are some of the challenges really of Unani medicine that we are facing. Yeah, as you can see, there is much work to be done. I wanted to finally, this is a local garden of the Leicester Abbey. This is really to adapt Unani to the local needs and the culture and the history of the people. And I wanted to thank some of the very important people who are really behind this work. I am the face of it really, but there are many, many noble people helping. Sheikh Yahya, for example, and Fatima, who really opened up United States of America by inviting us 6 years ago. And we continue to go there each year to train students, and they're in practice now in the USA. There is a local English lady who is actually our secretary of the Guild of Unani Medicine, and a practitioner and a teacher. We have Abu Shafqat Saab in UK, one of our students who actually really helped us to open up Spain. We have a lady from Morocco and France who's practicing there. And then obviously we have done some work in Turkey, but also through the Turkish Center in DCA in America. And there are many other individuals. And I actually have one individual, a young married man sitting next to me on a Sunday afternoon in England and giving his time and talents. His name is Hussein Ahmed. He's also the lifestyle healthy coach coordinator of Tibb transformation. So again, I want to thank all these people and many others, and I want to thank the organizers for giving me this opportunity in a very short time to share some of the work that we're doing. I hope it will inspire other people to come forward really to make this amazing, wonderful, wisdom-based tradition of healthcare and medicine and healing in these very difficult times that the humanity is going through. So we look forward to both eminent speakers and others who wish to get in touch with us. Obviously, I assume that through the organizers, we'll be able to share this. So again, thank you very much.